Are you suffering from a pain that has started after your recent surgery? Have you been left with a new pain that came on after a routine operation, such as a hernia or a knee replacement? Then you're not alone, because post-operative pain and what we call post-surgical neuropathic pain happens in 1 out of 5 patients who undergo any form of surgery. My name is Dr. Deepak Ravindran, and I am a practicing pain consultant for over 10 years. And in my 10 years of clinical practice, I have a huge number of patients who come to my clinic with precisely this form of post-operative neuropathic pain that can often be a challenge to treat, a challenge to diagnose, and then a challenge to manage. And it's important that a pain consultant is often involved early on in the care of this condition to get the best outcomes for you. So what is a pain consultant going to bring to the table, you may wonder? Because often with most of these post-operative pains, you would be referred to your consultant surgeon back again to see if there's been something that can be rectified. And often you're left with your GP or physiotherapist who are going to suggest various medications or even tablets and physiotherapy. But these are not going to be effective if it is a post-operative nerve pain. Because with this condition, we've realized now that it is quite complex. There are factors that can lead to this. Sometimes it's possible to predict who can be having this pain, and therefore it's important to have a thorough evaluation and a proper treatment strategy that involves the whole person approach. And you need something that's personalized to you. As a pain consultant, a lot of us are trained in doing this exact approach, getting a biopsychosocial model. Therefore, we are able to bring mechanism-based strategies. We can think of nerve blocks, we can think of electrical interference with the nerves that are sensitized. So we can think of spinal cord stimulation, pulse radio frequency, and these are options that could be considered. Often it's understood that psychological mechanisms or even stress can make such symptoms a lot worse, and therefore we have access to physiotherapists and psychologists who can help us in managing and getting a better quality of pain relief to your condition. So it's important that pain consultants are involved and are consulted much earlier on to get a proper treatment strategy for this. So what are you waiting for? It's time now for you to see your consultant and to your GP to make that referral to the consultant, and I would ask you to do that. If the waiting lists are long, or if you feel you would like to get access quicker, you may even have to consider private options. Because at the end of the day, recognizing and treating post-surgical neuropathic pain quicker is the best way to get to your quality of life.